Since Dr. Denton Cooley established the Texas Heart Institute in 1962, we have worked toward our mission to reduce the devastating toll of cardiovascular disease through innovative programs in research, education, and improved patient care. Over the last 5 years, we have been honored to work on some of our most promising grassroots research efforts. The progress we've made has helped shape the direction of several areas of research for years to come. It is because of your support that we are able to push the boundaries of discovery and impact the lives of so many.
Hi, I'm Stephanie Coulter, and I'm the director of the Texas Heart Institute Center for Women's Heart and Vascular Health, and I am coming to you from a screening program that we have developed. It is with your help and your fundraising that we've been able to establish this registry and this research project that has actually become the basis by which other organizations can replicate our work. We've actually used the data from this registry to apply for other grants, and we are very, very thankful for all the work and efforts that you guys have afforded and have allowed people like me and people like my team here to help provide medical services and important research on the biology, the risk factors, and the socioeconomic factors that lead to heart disease in our community. Thank you for helping us make it possible to serve our community and to rid our community of the devastating effects of cardiovascular disease. Thanks again.
Well, I want to say that the Texas Heart Institute Houston Heart Reach has really been an invaluable resource for our families in our community, because many of our families are uninsured. They have no access to medical homes, and this program has really brought that connection, that gap that exists in our community. Knowing your numbers is so important, and for many, including myself, we discovered that our numbers aren't what they should be. They're unhealthy numbers. And it also allows us to become connected to resources that can help us to make better choices in our health.
Heart disease is the #1 killer of men, women, and children. 5 times more women have heart disease than breast cancer. Why don't we know that? We don't know that because the word on the street is that heart disease is a man's disease. It's not true. Women are dying of heart disease every day. Through Heart to Heart grants, our researchers have unveiled new insights and discoveries in a largely overlooked and neglected area of research: heart disease in women. Significant gender gaps exist in cardiovascular medicine, but we're changing that. We recognize that men and women are different genetically, and we think at the level of cells as well. And by utilizing stem cell products from men and women enrolled in cell therapy clinical trials for heart disease, combined with the clinical data from those studies, we can begin to understand how specific proteins differ in people who get better and people who don't in response to treatment. We can also gain significant insights into if and how stem cells from men and women with heart disease differ, and perhaps open a door to new regenerative medicine strategies in both. Thank you for partnering with us, Texas Heart Institute, to educate the next generation of scientists. Thank you for taking action to improve the heart health of women around the world. As the #1 killer of men, women, and children, cardiovascular disease requires all our efforts. However, our progress would not be possible without your confidence, commitment, and support. You keep us motivated and keep us advancing and pushing forward. The next first in cardiovascular discovery will happen at Texas Heart Institute
You make it possible.
Thank you for making this possible.
You make it possible for saving lives and for bringing this resource into our community.
Come see what we do here at the Texas Heart Institute and let us involve you in the next generation science for treating heart disease.